Imagine living with skin so fragile it can tear and blister at the slightest touch. For 12-year-old Gabrielius Miserinkovas, this is a harsh reality. Born with a rare genetic disorder called recessive dystrophic epidermolysis bullosa, RDEB, his skin is as delicate as paper, making everyday activities a daunting challenge. But here's where it gets hopeful. A groundbreaking clinical trial has brought new promise to Gabrielius and others like him, offering a potential treatment for this debilitating condition. RDEB affects approximately 150 children in the UK, causing excruciating pain, severe itchiness, and life-threatening complications. With no current disease-modifying treatment available, patients and their families have to rely on dressing wounds and applying eye ointments to manage symptoms. However, this can lead to severe scarring, disfigurement, and even skin cancer. Gabrielius's journey with RDEB began when he was just a baby. His mother, Jolita Chekhovicieni, recalls the first 2 years being incredibly tough, as even the slightest friction could cause painful blistering. But when the opportunity to participate in a clinical trial arose, Gabrielius jumped at the chance. The trial, which involved receiving specific stem cells via an intravenous drip, has shown remarkable results. Gabrielius's wounds healed quicker, his skin was less red and inflamed, and he experienced reduced itchiness. He can now engage in activities he previously couldn't, like playing football and cycling. However, it's essential to note that while this treatment has brought significant improvements, it's not a cure. Gabrielius still needs to exercise caution to avoid falls or bumps, which could lead to severe injuries. The trial, funded by NHS England, the National Institute for Health and Care Research, and the charity Cure EB, has sparked controversy and debate. Some argue that the treatment is too experimental, while others believe it's a beacon of hope for those affected by RDEB. But here's the part that most people miss: the treatment's potential to reduce the risk of skin cancer, a common cause of death for RDEB patients. As Dr. Anna Martinez, the lead investigator of the research, notes, administering the treatment early and at regular intervals appears to reduce itch and improve wound healing, which over time we hope will reduce inflammation, modify the condition, and may reduce the future risk of squamous cell carcinoma. The study's findings have significant implications for the future of RDEB treatment. With Immune Bio committed to supplying the treatment at no cost for 12 months to all children who participated in the trial, researchers can continue to monitor their progress and gather more data. As Sharmila Collins, founder-trustee of Cure EB, expresses, we hope these cells will become part of routine clinical care to alleviate the significant suffering of children with this condition. And this is the part that sparks the most debate. Should this treatment be made available to all RDEB patients, regardless of age or severity of symptoms? We'd love to hear your thoughts. Do you think this treatment should be widely available, or do you have concerns about its safety and efficacy? Share your opinions in the comments below.